I'm the System Requirement Coordinator working under the direction of Dr. Cobra Ectedary with the Data and System Management section here at the State WIC office. Today I am here to give a brief presentation on our new WIC Connect mobile app. I hope that you find this presentation is a helpful tool in learning how to navigate the app, answering client questions, and understanding the relationship between the app and MyWIC. To get started, clients must first download the WIC Connect app from either the Apple App Store for iPhone or Google Play for Android. They can do this either by typing Michigan WIC into the search engine or by scanning the QR codes provided. These QR codes were previously sent to you in WIC eNotice 2018-17 on the flyers and client handouts, and WIC eNotice 2018-57 in the Frequently Asked Questions for Local Agencies document. The app is essentially divided into three sections: the login screen, the view for prospective WIC clients, and the view for WIC clients. I will go over each section separately to help you better understand the layout and function of the app. The login screen can be accessed by anyone who has downloaded the app. They do not have to be a WIC client, be eligible for benefits, or even establish an account to make use of these features. Features on this page include the ability for registered clients to log in, the ability for WIC clients to register, a summary of what is WIC, a tool to help determine eligibility, resource links, interactive maps to show WIC clinics and approved vendors, and finally an option to contact WIC. Established WIC clients can register an account for the app by selecting the existing WIC client's register option on the home screen. This will prompt them to enter their information to access the app and additional features specific to our WIC clients. When a client registers, they will need to enter a valid email address, create and confirm a password, and enter their WIC family ID, active EBT card number, and authorized person date of birth. It is important to remember clients cannot use their WIC Client Connect website login on the app. They must register separately for an app account. Clients can use the same email address and password for both accounts for convenience, but must go through the registration process. The Forgot Password feature on the home screen allows users to reset the password associated with their account in case they have forgotten. To reset the password, they will need to enter their email address that they used to register the account. An email will be sent to the address entered with a temporary password. Once the account has been verified, a new password can be entered. It is also important to note the Forgot Password feature will only work if an account has already been registered through the mobile app. The What is WIC screen provides a basic summary of the WIC program. This includes a brief description of some of the education, referrals, and food benefits they could receive as a part of the WIC program. An individual does not have to register for an account to view this information. This is a valuable tool in helping potential clients learn about the program. The Am I Eligible screen is another valuable tool in helping potential clients learn about the WIC program. This feature navigates the user through a series of questions to help determine if they may be eligible for WIC benefits. Depending on the responses provided, it may ask for additional information regarding income and household size. After the questions have been answered, if it is determined that the user may be eligible for benefits, they are offered the opportunity to register an account. The Am I Eligible feature utilizes up to 5 questions to help determine the potential for WIC eligibility. The first screen looks at determining categorical eligibility, if the user or anyone in their household falls under a WIC approved category. The next question looks at residency, and the third helps evaluate for adjunct eligibility. If the user or an individual within their household falls within a WIC category, is a Michigan resident, and is potentially adjunctly eligible based on their enrollment in another program, they will be navigated to the registration screen. Otherwise, they will be asked additional questions to determine household size and income. If the answers provided indicate that they may be eligible for benefits, they will be taken to a screen that informs them of this and offered the opportunity to register an account. Otherwise, if they appear to not be eligible, the app will provide reasoning for this determination, for example, not a Michigan resident or over income, and still provide them the contact information for clinics for further questions. The Resource Link screen provides links to several different resources with additional information or services for WIC clients. It also provides information to potential WIC clients regarding the resources available to them if they are eligible and enroll in WIC. These resources include links to wicchealth.org, the Michigan Care Immunization Registry for shot records, and the Conduit client website for balance inquiries. Additional resources include frequently asked questions, food guides and infant food inserts, as well as information regarding our summer EBT for Children program. The Clinic screen allows users to access clinic information and locate WIC clinics in their area through the use of an interactive map feature. For this feature to work, the GPS location setting must be turned on in the phone settings. If the setting is not turned on, the app will provide a pop-up reminder to inform the users to change the setting. The address and phone number for each clinic is displayed when a user selects any pin on the map. Users can also expand or limit their search using either the address search at the top of the screen or simply by zooming in or out at the bottom of the screen. The map default location uses the phone's current GPS location, but can be changed to display any area within Michigan. If a client reports that they are unable to find a clinic or no clinics display on their map, remind them to verify that location services are turned on and remind them to adjust the search scope. The default image will display clinics within 5 miles of the client's current location. They may need to zoom out to see additional clinics. The store screen provides similar functionality in that users can locate local WIC-approved stores by utilizing the interactive map feature. Similar to the clinics page, users can view store details by selecting any pin on the map and change the location by utilizing the address search bar at the top or the zoom feature at the bottom. The pins on this map are color-coded based on the store type. The red pins indicate grocery stores with pharmacies. The green are grocery stores, the blue are pharmacy only, and the pink indicate other store types like the Project Fresh farmers markets. This information can be viewed in the key under the eye icon in the upper right-hand corner. With our next update, this feature will include a filter option to allow users to select the store type they wish to view. The last option on the login screen is Contact WIC. The Contact WIC page provides 2 different methods for contacting WIC. The first is Contact WIC agencies. This provides a list organized by county of WIC local agencies and their phone numbers that clients can contact. There is also a fillable form that users can fill out to contact the state WIC office with any questions or problems regarding the app. In this, clients provide their name, address, city, zip code, email, and their question. WIC staff use this information to contact the user and respond to their question. Next, I will review the functions of the app related to prospective WIC clients. How a prospective WIC client will register what they see when they log in, entering family information, and scheduling an appointment. To register an account as a prospective client, users must first complete the Am I Eligible screens and be determined to be potentially eligible for benefits. Once they select the Register option, they must enter their first and last name, birth date, email address, and create and confirm a password. These passwords must be between 8 and 20 characters, contain at least one lowercase and one uppercase letter, and contain at least one number to be valid. Once a prospective WIC client successfully registers an account and signs in, they will be directed to the home page. The home page will display family information, schedule appointment, and what will you need. If a user registers an account as a prospective WIC client and then completes the certification process, the app will automatically update their account to display the WIC client information. The family information contains 5 sections: proxy information, participant information, address, phone, and other. All of these sections must be completed before a user is able to schedule an appointment. All of the information that the user enters into these screens will be transferred to the corresponding fields in MyWIC. The individual's details listed on the family information screen are those of the authorized person, or in the case of prospective clients, the individual who registered the account. Prospective clients can update this information at this time. However, once they complete the certification process, any changes to the authorized person's information must be communicated directly to the WIC clinic. The proxy information screen allows a user to update information on proxy persons, including the ability to decline the use of a proxy or add a new person as a proxy. The participant information screen allows the user to add and update participant information. The first page on the participant information screen will contain the mother's information if she is wishing to enroll as a WIC participant. If the user is only registering children, they shall select the option at the top that says I am registering child only, and they will not need to complete the mother detail section of the screen. To add children, the user should select the Add Child button and fill out the designated information for the child. This includes the child's name, date of birth, and foster status. They will need to repeat this for each child they wish to enroll. It is important to note that after they finish adding all the necessary children, they must select the Save button on the main participant information screen in order to preserve the information. The address page allows the user to add and update their street and mailing address. If their mailing address is the same as their street address, they will be able to select the Same as Street Address option to prevent them from having to enter the information for a second time. Note, to select a city, the user should select the Show Cities button after entering their zip code to select from a drop-down of cities within that zip code. The phone page allows the user to add and update their contact information. Users have various options on this screen. They can select the No Phone option to indicate they do not have a phone, select Add Phone to enter a new phone number, or edit existing contact numbers. When adding a new phone, they are able to enter the phone number, select the phone type, and indicate if it is the preferred phone, if they are requesting no calls, or to receive text messages on this number. They can also enter a comment if necessary. This comment can be viewed in MyWIC in the contact grid under the comment column. To edit or remove an existing contact number, Users can select the arrow next to the phone number. This will allow them to edit any of the associated details or delete the number entirely. Users are able to enter multiple contact numbers through the app. The other screen, under Family Information, allows the user to add and update additional information, including family size, migrant status if applicable, homeless status if applicable, if they require a translator, disability accommodations if needed, primary language, and if they were referred by another program. The only required fields on this screen are the family size and primary language. All other fields on this page are optional and can be completed at the discretion of the user. After completing the family information screens, prospective clients can schedule an appointment through the app using the Schedule Appointment feature, which is available on the home page or in the left-hand side menu by clicking the menu icon in the top left-hand corner of the screen. On this page, they must enter the desired date range for the appointment, if they have a desired time, morning, afternoon, or any time. Then they must select a clinic. The clinic drop-down menu will display all of the nearby clinics sorted by distance. The user can select any of these clinics. Once a clinic is selected, they can search for available appointments. After the user selects search, they can receive one of two outcomes. If no appointments are available in their designated range, they will receive a pop-up stating that appointments are not available for the selected clinic. Users would receive this same message if either all of the appointments are booked or if the WCC appointment type is not established in the schedule. If users receive this message, we recommend they contact the clinic directly to schedule. If appointments are available, the user will receive a list of available appointment times that match their search criteria. From this list, they can select and schedule an appointment. Once an appointment has successfully been scheduled, the information will display on the client's homepage. To view additional details for this appointment, including clinic address, phone number, they can select the arrow next to the appointment. If you do need to reschedule an appointment that was created through the app, a staff member will need to contact the client directly to discuss availability and rescheduling. The What Will You Need feature on the home page provides detail on the required documents that prospective clients must bring for specific appointment types. After a prospective client logs in, they will still be able to access clinic information, locate other WIC clinics in the area, and find out where to shop using the clinics and store screens that I described earlier. The user can also update their existing password through the Change Password screen. This screen can be found in the left side menu just above the Logout option. To change their password, the user must enter their current password, enter the new password, and confirm the new password. Next, I will review the functions of the app related to our WIC clients, how a client will register, what they will see when they log in, requesting appointments, and other features available through the app. As I mentioned at the beginning of the presentation, established WIC clients can register an account for the app by selecting the existing WIC clients register option on the home screen. This will prompt them to enter their information to access the app and additional features specific to our WIC clients. When a client registers, they will need to enter a valid email address, create and confirm a password, and enter their WIC family ID, active EBT card number, and authorized person date of birth. A valid password must be between 8 to 20 characters, contain at least one lowercase and one uppercase letter, and contain at least one number. It is important to remember clients cannot use their WIC Client Connect website login on the app. They must register separately for an account. Clients can use the same email address and password for both accounts for convenience, but must go through the registration process. I also want to make note that the EBT card used to create an account must be active in MyWIC. If an EBT card has been marked as replaced or stopped, it cannot be used to register an account. We have had some questions regarding if former WIC clients can create an account through WIC Connect. To answer this question, yes. They can use their EBT card number in congruence with the other identifying information to create an account, even if their family has been terminated. But this is only the case if they have an active EBT card. If a former client does not have an active EBT card or their family ID, we do recommend that they contact their WIC clinic first to schedule an appointment and obtain an active EBT card if appropriate. The home page for a WIC client is different than what displays for a prospective client. WIC clients can view appointments, benefits, family information, clinics, stores, the UPC scan feature, and nutrition education messages and important reminders. Existing WIC clients can request an appointment through the app, but since their appointment needs are varied, they are not able to schedule an appointment directly through the app. Requests for appointments can be made from the appointment screen. To request an appointment, the client must select the plus icon located on the upper right-hand corner of the appointment screen. Once on the request appointment page, they must select the client the appointment will be for, their desired date range and time of day, and select their clinic. The clinics displayed for clients are limited to the agency to which they are assigned in MyWIC. Once they select the clinic, they can enter a comment or request. This is where the client can indicate what kind of appointment they need. For example, a client can indicate if they need to see the breastfeeding peer counselor or if they need a nutrition education appointment. This provides important details to the WIC staff member when looking to schedule the appointment. Once the user's request is complete, they will select the Request Appointment button at the bottom of the screen to submit the request to the clinic. After an appointment has been requested, pending requests can be viewed on the appointment screen in the Appointment Request grid. The submitted appointment requests will appear in MyWIC under the WIC Client Connect appointment flag. A staff member will have to contact the client to schedule this appointment. I will further review this process in the WIC Connect and MyWIC section of this presentation. Through the appointment screen, clients can also view details on upcoming appointments. This includes the clinic where their appointment is scheduled, the clinic address and phone number, the names of each participant who have an appointment scheduled, the dates and times of each of the upcoming appointments, and the information icon. This icon will provide them a list of required documentation and information they must bring for each appointment. The appointment screen will also display any pending appointment requests they have. Appointment requests will continue to display for the user until the request has been marked as resolved in MyWIC. The benefit screen allows clients to view their benefit balance and other details for current and future benefit periods. Clients can navigate between current and future benefits by utilizing the arrows at the top of the screen or by selecting the Future Benefits button at the bottom of the screen. A client can select any food item displayed on their benefit screen to see additional information for this category, including benefit period, available quantity, and an approved brand list. Clients can also utilize the UPC scan function to determine if the item is WIC approved and see how much of that benefit they have remaining for the current benefit period. To access the UPC scan feature, a client can select the option from the bottom of the benefit screen or select the feature directly from the home page. To scan an item, the user must simply hold the camera over the barcode. Once the barcode is registered, additional information will display. When an item is scanned, there are 3 potential outcomes. First, there is the display when the product is WIC approved and the client has benefits remaining for the current benefit period. Notice that this will display the quantity remaining next to the image, the product description, and the benefit start and end date when they can redeem this benefit. This information is updated in real time based on the products they have purchased with their WIC benefits. Next, there is the display when the product is WIC approved but the client does not have the benefit. This could be the case if the client has redeemed all of this benefit for the current period or if the product was not included in their food package. Please note it is still a WIC approved item, so the top of the screen will still display WIC eligible, but the quantity remaining will be 0 and no benefit period information will be displayed. Finally, there is the display when the product is not WIC approved. This will simply state that the item is a non-WIC eligible item. If a client reports struggles with this screen, including if they feel the display is not accurate, please encourage them to send screenshots. This is an important detail in helping address any potential issue. The next feature I would like to discuss is the Family Information screen. From this page, existing WIC clients can view their family information and update some of the information. While the format of this screen is the same for both potential clients and established WIC clients, it is important to distinguish a key difference. While prospective clients can update and edit all fields within the sections, clients can only edit a select few fields. Clients can update their email address, proxy information, address, phone number, and their voter registration in the Other section, but they cannot make changes to participant information, birth dates, family size, primary language, authorized person, or several other fields. If changes or corrections need to be made to these fields, the client still needs to contact their WIC clinic. The PDF Forms screen is available to WIC clients from the left-hand menu. This screen displays some of the documents available in print forms in MyWIC. This includes the shopping list, nutrition education plan, VOC, referral notification, client agreement, and vendor listing. This feature will be helpful in making sure that these valuable resources are readily available to our clients. The broadcast message feature is available to the client from the left-hand menu or by selecting the envelope in the upper right-hand corner of the home screen. This feature is being enhanced with our upcoming upgrade. After the upgrade, the broadcast messages will display appointment notification messages if the client has an appointment within the next 7 days, benefit expiration reminders if the benefits are expiring within the next 15 days, certification end date reminders if the certification period ends within the next 15 days, food package renewal reminders if the package prescription expires within the next 15 days, and nutrition education messages. Messages displayed will be determined by the client categories within the family and are geared towards reinforcing good nutrition practices. After a client logs in, they will still be able to access clinic information, locate other WIC clinics in the area, and find out where to shop using the clinic and store screen by selecting the options either on the home screen or the left-hand side menu. The user can update their password through the Change Password screen. This screen can be found on the left side menu just above the Logout option. To change the password, the user must enter the current password, the new password, and confirm the new password. Finally, the My Account screen displays family account details, including email address, first name, last name, family ID, EBT card number, and authorized person birth date. This information is read-only and cannot be edited by the user, but it will display the most up-to-date information as entered into MyWIC. For example, if a new EBT card is issued, the app will automatically update the information displayed on this screen. I do want to note, while the EBT card validation is necessary to create a WIC account, after the account has been established, the client will be able to manage their WIC Connect account independent of their EBT card. So changing or deactivating an EBT card will not affect a client's ability to log into their WIC Connect account or view their current benefits once they have an established account. If an EBT card has been lost, stolen, or damaged, the client must still contact their WIC clinic or conduit to replace the card. Cards cannot be replaced through the app. Now I want to review the interaction between WIC Connect and MyWIC. This includes schedule templates, appointment requests, appointment notification, client records, and available resources. For WIC Connect users to schedule appointments through the app, the WCC appointment type must be available on the clinic schedule. This can be done in the admin module of MyWIC, either by adding the appointment type to existing columns in your MyWIC schedule, or by creating a new column specific to the WCC appointment types. The WCC appointment type in MyWIC allows clients to schedule through either the WIC Connect app or the WIC Client Connect website. To edit an existing template, you will need to navigate to the template screen located under the scheduling tasks in the admin module of MyWIC. Once there, make sure the appropriate local agency is selected, and then select the applicable template name from the drop-down menu. Once you select the template, the outline will display in the grid below. You will then hit the Edit button at the bottom of the screen. After you select Edit, the Edit template screen will display. This will show you each column that is in the template, the sort order, start and end times, and the appointment types. To add the WCC appointment type to any or all of these columns, simply check the WCC box for the appropriate column. Make sure to select Save or Close when finished to make sure your changes are preserved. Once the template has been updated, you will need to regenerate the schedule for it to reflect in the clinic module. To do this, you will first need to undo your existing schedule using the Undo Schedule feature. Then go to the Generate Schedule screen. Select the updated template and the applicable clinics. Then set the date and day parameter for when the template is to be generated, and select Generate Schedule. This will not impact appointments. that have already been scheduled. If you want to create an entirely new column specifically designated to the WCC appointments, you will need to add this column to your template. To do this, you will first need to create the column in order to add it. You will still want to navigate to the template screen located under Scheduling Tasks in the Admin module of MyWIC. Once there, select the Add Schedule Staff button on the bottom of the screen. This will bring up the Add Scheduler Staff window. From here, select the New button at the bottom of the screen. This will allow you to type in a new staff name and add it to corresponding clinics. In the Staff box at the top of the window, you will want to type in the column name. Remember, the width of the column is dependent on the length of the title you enter here. If you put a space in the title, the text will wrap. A trick to help adjust the column size while keeping the title easy to read is using punctuation like periods, underscores, or dashes in place of spaces if you do not want the title to wrap. To allow the column to be used at the clinic, hit the Add button on the left-hand side of the screen and select the appropriate clinics. Repeat this as necessary until all of your desired clinics have been added. Don't forget, this is also where you specify if you want this to show up in your appointment search. If you are reserving this column for the use of your WIC Connect clients only, you will likely not want this to be displayed in your appointment search results, so make sure that checkbox stays unchecked. Once you have created the new column title, you will want to add that column to your applicable templates. To do this, from the template screen, select the appropriate template from the drop-down menu and then hit Edit. Once on the Edit screen, you will want to select your new column you just created from the Staff drop-down menu at the top of the screen. Once selected, choose the Add Staff button to add the column to the template. Once the column has been entered, you will need to set the sort order. This tells the system in what order you want the columns to be displayed. The highest number will display on the far right, while the lowest number displays on the left. After entering the sort order, you'll want to hit the Add button at the bottom of the screen. This will add a line to designate the available times and appointment types. Enter the desired times and appointment type before selecting Save. If you want there to be a break in these appointments throughout the day, simply add a line for each available section of time. For example, if you take lunch from 12 to 1, you would want the first line to go from 9 to 11:45, and then add a second line to go from 1 until the end of your day. Once the template has been updated, you will need to regenerate the schedule for it to reflect in the clinic module. To do this, just go to the Generate Schedule screen. Select the updated template and the applicable clinics. Then set the date-day parameter for when the template is to be generated and select Generate Schedule. This will not impact the appointments you already have scheduled. Now that you have your schedule set, I want to discuss the appointment requests. Existing WIC clients can request an appointment through the app, but they are not able to schedule directly. When an appointment is requested, a pop-up will display upon logging into the clinic module for the day, stating the number of requests that have been made. These requests will appear in the WIC Connect appointment flag on the toolbar at the top of the screen. a staff member will have to contact the client to schedule an appointment. These appointments can be scheduled by any staff member that has permissions to schedule appointments. The flag will be illuminated when there is a new request, but is always available to view pending requests or to verify that no request exists. While these appointments were requested using the app, it is important to remember that when scheduling these appointments, they should not be marked as WCC appointment types, but rather should be marked based on the client's appointment's needs. For example, a CEval, EDU, reassert, or whatever the client needs for that appointment. When you select the WIC Client Connect appointment flag, the appointment request grid will display. The grid will display family ID, client ID, authorized person name, desired date range, period, status, and any special notes from the client. From this grid, you can select a row and make the client active to make the scheduling process more efficient. After an appointment has been scheduled or the request has been handled, select the Resolved checkbox to remove the request from the grid. If prospective WIC clients schedule an appointment directly through the app, a pop-up message will display upon logging into the clinic module that will tell the staff how many WIC Client Connect appointments have been scheduled for the next day. These appointments will display on the daily schedule in the same fashion as all other appointments. If a prospective client schedules a WCC appointment for the same day, the staff may not get the pop-up notification as they are already in the clinic module, but the appointment will display on the daily schedule as soon as the schedule is refreshed. I just want to remind you that all the information that is entered or updated by clients and potential clients through the WIC Connect app will be transferred to the corresponding field in MyWIC. This is especially helpful when clients need to update their address or phone number when moving, as it can be done at their convenience through the app. But do remember, there are some fields that the clients will not be able to update. The reverse is also true. Any update that is made in the MyWIC system will display in the app for the client to view. Just a quick reminder of the resources available to you apart from this webcast. Included in WIC eNotice number 2018-57, there are frequently asked questions and answers for both local agencies and users that summarize some of our most common questions. There is also the WIC Connect user guide that walks you through the app step by step, and a PowerPoint of screenshots from the mobile app to help you become familiar with the display of the screens. All of these resources are also available on our michigan.gov/WIC website on the WIC Connect mobile app page. I also want to remind you of WIC eNotice number 2018-17 that included flyers and summaries that can be handed out to clients in the clinic. If you or one of your clients is experiencing issues with the app that you think may be a bug, or you have questions or concerns regarding the app, please email either myself or Anthony Spagnolo. Both of our contact information is included in the eNotice listed, and my information is listed again at the conclusion of this presentation. We do have some very exciting things coming up in the near future. First, I want to remind you to come visit us at the 2018 WIC Training and Educational Conference on May 15th and 16th if you have more questions or want to see additional demonstrations of the app. We will be happy to answer all of your questions. We also have promotion of the app starting soon. An advertising campaign utilizing Facebook and mobile app advertising has been created in partnership with the State of Michigan's Communication Department and a contracted marketing firm. Targeted advertisements will go out to existing and potential WIC clients via Facebook and mobile app ads. The mobile app ads will appear on mobile apps that are likely to be used by our target audience and are expected to be viewed by 3 to 4 million Michiganders. The Facebook ads will target the same audience and are expected to be viewed by approximately 500,000 Michigan women. We also have our first update to the app that will be available in the beginning of May. This is targeted towards making our app more user-friendly while keeping it up to date. Some of the features and enhancements that will be included in the update is the ability for the app to translate into Spanish, updating some of the displays, and adding the filter to the store map. We are actively working on the process to create test accounts to enable our WIC staff to access and navigate the entire app. Please bear with us as we finalize this process and get the necessary approvals. I will continue to update you as I have more information. At this time, we'll take a brief 10-minute break. Please submit your questions you have in the link below. All right, so we did have one question come in over the break, specifically regarding terminated clients. The question wanted to know if a terminated client can still request an appointment or if the app would give them a message saying they needed a recertification appointment. So if the terminated client registered an account with their EBT card number and family ID, they would be able to request an appointment. At that time, the WIC staff would contact the client to schedule that recertification appointment. The app does not tell the client what type of appointment they're in need of. So if they need a recertification appointment, if they're aware of that, they can indicate it in the comments. Otherwise, the staff would need to discuss that with the client directly based on their status and other needs. So hopefully that answers your questions. If you guys have further questions, please don't hesitate to send me an email. I'd be happy to answer your questions, or come see us at the conference here in the coming weeks. We will be there and can walk you through the app if you would like. I do want to thank you for taking the time out of your day to watch this presentation. I hope that it has given you valuable information that you can use in your clinic. Like I said, if you have further questions, please don't hesitate to reach out to me at my email address, wrestlerk@michigan.gov, or at 517-335-5633. Again, thank you for your time.